Our medical staff is always focused on quality and always giving the best possible care for our patients. And we do a great job of that. We have excellent trained medical staff throughout Intermountain.
Care teams at Intermountain Healthcare have achieved amazing things. We aim to treat our patients and each other with compassion and mutual respect. Through these actions, we achieve fabulous outcomes. I can think of several examples of how teams have come together, but I heard a recent example that I would like to share with you. We had a provider who'd been in practice for a total of 4 weeks with a much reduced schedule. He was allowed to have that much reduced schedule so that he could get to know his team, understand how the workflow took place in his clinic, and understand processes. At the end of the 4 weeks, he came to his team and said, "We're ready. I know we're ready. I want you to increase my schedule tomorrow by 70%. So his patient service representative made schedule changes for him that afternoon. His medical assistant said, "I'm so excited, we've got this." Now that physician had also worked really hard to master the intricacies of virtual visits, and his patients were thrilled because they'd been waiting for better access at that clinic for so many months. These kinds of caregivers and care teams make an incredible difference, not only to their teammates and their clinics, but to the community and our company as a whole.
One of our providers came forward and said, I see there's 2 areas where we're spending money that really isn't necessary. One was around epoprostenol, which is an inhalant for critical care patients. And the other was around what we call proning beds, which are beds that will turn a patient back and forth. What we realize is that these beds that turn the patients over, when we look at the data, it doesn't show that it's any better than having someone else do it. The amount of money that we were spending on these beds is significant. And from a provider idea, we changed that and we've removed those beds from our system. Same time I talked about the epoprostenol. By switching to epoprostenol, we're able to decrease the amount of money that we spent on our patients, which wasn't improving the care. And hence, by bringing that cost down, our providers gave us a great way to improve the value for our community and our patients in the ICU.
At Intermountain, one of the most important things is teamwork, and hearing from physicians and advanced practice providers, hearing your ideas, understanding what you need, understanding and working together to make healthcare better, make it safer, improve quality, make it more affordable. This is who we are. And so when you have ideas, we want you to share those. Talk about them with your teammates, work together with nursing and your clinic manager. And there's so many things that you all will solve just on your own. And when you need help, or when your idea is one that really transforms things, then we have the whole medical group and the entire clinical network to share that with. Please know that as part of Intermountain, as part of Intermountain Medical Group and our clinical network, it's your ideas that matter most.